Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.
When to start PED use in younger competitors. The question of when to start PED use is critical. The best starting point is after natural potential has been largely exhausted. At least 3 to 5 years of consistent, high-quality natural training is recommended. This ensures peak testosterone and growth hormone levels occur around ages 19 to 20. There is only a gradual decline after this period. In males, full brain development continues until approximately age 25. In females, this occurs slightly earlier and influences emotional maturity and decision-making. Early adulthood is also when careers and long-term relationships begin to stabilize. This stability supports better long-term decision-making. For females, peak bone density occurs between ages 18 and 20. Disrupting estradiol levels during this period can negatively affect lifelong bone health. Population data show the average age of first steroid use is around 22. A more appropriate minimum age for consideration is closer to 23 to 26. Using PEDs before maximizing natural hormonal potential is unnecessary. Those years should be leveraged for natural progress. This period also allows time to establish life structure. That structure supports long-term commitment if enhancement is later chosen. Coaching young athletes and managing risk. Many young athletes will choose to use PEDs regardless of advice. Education and risk reduction become the priority. For risk-averse coaching, long-term health must remain central. Fertility considerations should be addressed early. For young males, fertility supportive strategies should be planned in advance. This includes preserving future options, not just short-term outcomes. Coaches must operate within their own ethical and legal comfort. You are not required to accept every client. Managing expectations is a core coaching responsibility. Many young athletes overestimate how quickly success will occur. Setting minimum natural training requirements is reasonable. At least 1 year of natural training may be required before PED discussion. Demonstrating natural progress in similar athletes builds trust. It reinforces patience and long-term thinking. Choosing to pursue professional bodybuilding is a long-term commitment. It often implies lifelong hormone replacement after competition. This decision should be framed honestly and clearly. There is no casual or short-term version of this path. Older competitors and increased risk. Older competitors face different physiological realities. Organ systems have accumulated years of stress and wear. PED tolerance decreases with age. Hematology, blood pressure, and cardiovascular risks increase. Older athletes experience side effects at lower dosages. Risk escalates more rapidly compared to younger competitors. Coaching older athletes requires stricter monitoring. Regular lab work, blood pressure checks, and cardiac imaging are essential. PED dosages must often be scaled back. Risk thresholds should be clearly defined and enforced. At this stage, reward rarely justifies aggressive escalation. Boundaries must be set early. Once competitive potential is realized, exiting competition should be planned. Continuing indefinitely compounds health risk. Exit strategy, identity, and long-term perspective. Every competitive career requires an exit strategy. Remaining in peak level competition indefinitely is not sustainable. Athletes should build careers outside of competition. Coaching, education, or business provide long-term stability. Bodybuilding can become deeply tied to identity. It is something you do, not who you are. When identity is too narrow, transitions become difficult. This increases emotional and psychological strain. Choosing when to stop preserves agency. Waiting until injury or illness forces the decision, removes control. Ending competition should be intentional. It should be based on health, fulfillment, and long-term goals. Enjoy the process while you are in it, but recognize that it must eventually conclude. The goal is to leave the sport on your terms, not as a result of preventable regret or avoidable harm.
Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.